First things first, my name is Morgan Ray. I'm the admissions coordinator here at Flathead Valley Community College, and I'm going to be helping kind of moderate this panel. So I do not work in the healthcare field, but we're going to talk to some people who do, and those who help train people to go into the healthcare field. Pam, you're top of the screen for me, so if you could introduce yourself first, please.
You bet. I'm Pam Klein, and I am the CNA and Nursing Lab Coordinator here at FVCC. I have a background in nursing where I've worked many different areas, and I have been training CNA students for about 25 years, and I'm still involved in some of their training and their testing.
Wonderful. Thank you. John?
Good morning. I'm John Miller. I am a new CNA graduate. I'm still in school, continuing my education, but yeah.
Continuing your education in what? Sorry.
I'd like to be a medical assistant or maybe a RN, so lots of opportunity.
Perfect. I'm sure we'll talk more about that. And Jesse, if you could introduce yourself.
Hi, my name is Jesse. I'm a nursing supervisor here at KRMC. I started my career here working as a CNA and worked for about a year before becoming a nurse. So, yeah.
Awesome. Wonderful. We may have somebody else hop on the panel, but we're going to go ahead and get started with our questions. First things first, everybody wants to know, what is the craziest thing you have experienced in your job? Or it can be your proudest or coolest moment. Keep in mind, these are high school students. Jesse, why don't you kick us off?
So I work primarily on an oncology unit, and we did a lot of big surgeries and stuff. So seeing kind of the wounds that we had to help patients heal up from and get back on their feet, was pretty big. I mean, I had never seen anything like the types of surgeries that we do here now. So it was kind of a surprise, but also it was really interesting for me. I'm into biology and sciences, so it was really fascinating to see just how our bodies heal and recover from some pretty amazing surgeries. That's working on a surgical unit has that aspect to it, which is pretty interesting.
Wonderful. John, what have you seen so far? You said you just started.
Crazy. I haven't seen a lot of too awkward weirdness because I'm newer, but I mean, anything that you can do to help a person to be comfortable is important to me, even if it's just simple like getting their water closer to them just so they're not struggling to get it, to reach for it. That makes me feel really good. So I mean, anything you can do to help them it doesn't have to be like super hard. It's easy.
I like that. I like that a lot. Pam?
Well, I'd have to say that I'm going to address some of the proudest moments, and that has been watching students who I may have known as a small child become a CNA student that I train, and then later be a student I had in LPN clinical, and then go on to be an RN student, and then be out there giving care to my own family members and seeing them take what we taught them and really doing it the way they were trained, and knowing that that's making a difference toward the future generation of CNAs and nurses.
I have to say, I'm really proud of our students, and I know, because I know how hard everybody works here to train them, like I feel really confident when I go to receive healthcare in the area because I know that everyone has been really well trained. So why, Pam, if you could tell us why you think CNAs are an important part of the team and kind of what a CNA does.
Well, the CNA is an assistant to the nurse. That's what it stands for, a certified nursing assistant. We as nurses can't always do everything that our patients need because there is a lot that's needed when they are very sick. And CNAs perform some of the duties that we as nurses also do, but giving baths, taking vital signs, feeding the patient, helping exercise them, because we can't be everywhere at once and we need those additional hands and eyes and ears. Many times they spend more hours a day with the patient than we as a nurse do, and we rely on them to come and let us know things like, Mr. Smith just isn't acting like himself today. Can you come check him out? That he might have been fine last time we were in the room. So we really do rely on them to be our extra set of hands, but also to tune into the patients and let us know when they see something that is wrong.
Thank you. John, what would you like to add to that? Why do you think CNAs are an important part of the team?
Oh, there is so much level of caregiving that people need. Like I've seen elderly patients with dementia, or people coming out of surgery that I monitor patients and watch for their safety. And I mean, they're at a really critical state because they just came out of surgery. Their thinking isn't quite where it normally is. So they're really confused and always trying to get up, pulling their lines, or if falling out of bed preventatively, which would take the patient far worse than before the surgery. So, I mean, there's a lot of different, they just need a lot of help. Sometimes people need to be in there with them constantly through a 24-hour period or more. So CNAs can help in a large way.
I think that's really important work. Jesse, what would you like to add? Why are CNAs an important part of the team?
Yeah, I would just agree with what both Pam and John said. They're a vital role to the care of the patient, and I can speak to what it's like, and Pam alluded to it here in the hospital. They're just that they're that extra set of eyes on that patient. They're watching, and really, they get to know the patient better than the nurse does, honestly, because their time there is, they're spending the time changing the bedding, and they're there talking to them as they're helping them with their meal and stuff. They just get to really get to know patients, and they bring a lot of pertinent information to the nursing team and I really felt like a valuable team member when I was working on the floor as a CNA, just with that nurse, realizing that everything, like the vitals that I do, letting the nurse know what was going on, if there was any changes, really helped out a lot, because nurses have a lot on their plate, and you get to really be that safeguard that nothing gets missed.
So saying that, what's a critical trait or something a skill that you need to be successful in the career? Jesse, why don't you keep going?
I think just time management, there's a lot on your plate when you're working in the hospital, especially, and I think just every CNA, you have to prioritize what needs to be done, the baths, and how to do them, who's going to take the longest. Might want to put that one to the end of the day. You just need a good time management process. You want to be able to get the vitals done, figure out what's most important, have them done, and then move on through your day and be ready for the unexpected. I can tell you what, a lot of nurses or CNAs have walked into rooms and found the patient on the floor, or food thrown everywhere, or worse, maybe it was a return food, which a patient possibly vomited, and then you were coming in to do vitals, and now you're cleaning up and you're changing the patient. And so as a CNA, you just have to be ready, and it's a really rewarding job that you really feel like you did a good job. Patients are extremely appreciative to their CNAs, because you've helped them through a really tough time. Anybody who's in the hospital is having a bad day. So the CNA comes in, and even if you're just a positive person who can cheer them up, tell them a joke, that alone, just a smile can really make a difference for these patients who are in an otherwise tough time. So I think that CNAs, I really think it's a great role to start off in medicine. You learn a lot about just how hospitals work. I mean, if you're looking to go on, or if you're just looking to work a great job, it's a really great place to be.
John, what would you like to add to that? What are some critical skills or things that you need to be a good CNA?
I think openness, because you'll see stuff that is um, different than in like a office job. So you need to be prepared and open to be okay with that and act like it's nothing. Um, so that was new. I think being kind and patient, but also with openness. You don't know their background, you don't know their history. You just want to try to be as kind of plain and vanilla as you can to match their personality and let them express themselves so you can match it and give them what they need. Um,
I really love that. Give them what they need. Pam, what would you like to add?
Well, I'm going to tag off a little bit of what John and Jesse said. Flexibility and adaptability. I think we all know that it takes somebody with a heart of kindness and compassion to do healthcare, but we don't necessarily stop and think about that flexibility. You have a game plan for the day and you know that it's going to change. It's going to be responding to whatever that patient needs at the moment, whatever the situation is, and being able to gracefully change what it was you planned on doing and make that patient feel like they didn't become a burden to you, that you are there to take care of them. I also think that understanding that when you are in there giving care to them, it becomes oftentimes emotionally challenging, and you have to be able to still give that compassionate care and separate your emotions. In long-term care, you may get very close to your patients because you care for them day in and day out for months and sometimes years, and you need to continue to be professional and yet caring, and that can be difficult to separate. But as Jesse mentioned, it is very rewarding. It can be just knowing you have made a huge difference in that person's day.
Love that. So if you, Pam, want to go ahead and start us off with what an average day of work is like for your students, because you oversee the CNA program class.
So as students, they're going to spend a lot of time studying and learning the skills of being a CNA. Right now, the class that we're offering is a blended class. They're going to do coursework online. So for every student, that looks a little bit different of how they choose to finish their online assignments and when they watch their videos. It gives them a lot of flexibility that way. And then once a week, they're going to come into the lab and they're going to do hands-on practice of those skills that they've been watching videos about, what they've been reading about. The instructor will often give them a little lecture on the topic, answer their questions that they had. We try to offer also a face-to-face class where they will come in it depends on the instructor. It might be an hour, 2 or 3 times a week. It might be that they're coming in for a block of time, a couple of evenings a week, and having lecture on those topics and watching videos in class, having class discussion, and then getting up and practicing those skills. So there's a lot of, they have to practice them, and then they also have to demonstrate them individually to the instructor and show, I can safely do this when you take me out to do this on patients. If they can't safely do it on mannequins, then they need to repeat, repractice, those types of things. So it depends on which of the class they're taking, face-to-face or the blended, what their day might look like.
Okay, thank you. John, what about you? What does an average day of work look like for you?
more or less while I'm in the program, correct?
Mm-hmm.
Oh, so I really found the course really streamlined. It was really nice. Like you had your book work, which you know, I had like I had plenty of time to read it, and it's nice. It's pretty easy reading. It's mostly practical, like common sense. So it's nothing abstract or really new. So it was really a nice level. So a lot of people can start. So don't be intimidated by the course or anything. If you're willing to learn, you can do it. So yeah, you would just read. I would go online, the Eagle Online, take my quizzes. Um, there, it there is the quizzes are kind of lengthier, but it's almost like a course that you think, oh, I just read these 4 chapters in the last like 2 days. I can go ahead and go through it really pretty quick, and then you're like, oh yeah, there's going to be quite a few quiz questions.
Mm-hmm.
But it's almost there's so much information packed in super simply. You're covering it super fast, and you almost feel like there's not as much information as there is. And so once you get to the quiz, you're like, oh yeah, I just learned quite a bit more than I thought I did. But yeah, I love the hands-on. It was great because you got to work with a partner, and then you also have the mannequins and the assimilated bodies, so you're in a safe environment. So yeah, I love hands-on working. It was nice to get to work with your partner because it was less awkward because you're like, okay, I've never changed a bed with a person in it before. I was like, this is brand new to me. So we're both scratching our heads a bit. So it was really good to get the practical aspect of it. I love that.
Awesome. Thank you.
Yeah.
Jesse, what would you like to say a day of work is like for you?
As a CNA here in the hospital, you're going to start off your day with an assignment of about 5 or 6 patients, and you know, your process is to kind of sort through them and see you know, who's going to be up first in the morning. You know, if you're working on the days, or if you're a night shift CNA, you're going to be looking at who's going to go into bed first, so you want to get in and see them first. And then kind of go from there. You're going to do your vitals, then you're going to kind of check to see if they need help with breakfast. Then you're going to make probably a bath plan for the day, and then kind of work on a mobilization plan, which is where you're getting patients up to help them move and do their walks and their activities. And kind of throughout the day, then you kind of start over. By the time you get done with all that, it's time for noon and vitals, and time to do more activities in the afternoon. So it moves pretty quick. And usually there's patients who are discharging, and you're helping to get them ready to go home. And then there's the new patients coming in post-surgery that are going to need frequent vital checks and so forth. That your day will fill up. And so you get to hit the ground running. And it's pretty quick paced, which is kind of fun. It makes the day go quick. And you get to spend that time getting to know some patients, usually for a few days, and then discharge them home after a few days. So it's a fun process.
We have about 10 minutes left, so if anybody has questions, you can go ahead and drop them into the Q&A, and I will go ahead and ask those of our panelists. So if you have questions, drop them in the Q&A. Otherwise, I still have a list of questions, and I'm going to keep going. I hope that's okay with you guys. So John, why don't you start us off? What are some of the most challenging aspects of the job? You mentioned a little bit about, you know, trying new material for the first time, learning things. But what would you say has been the most challenging in your education?
The education, I think, is good. When I started working, I didn't realize that the shifts were 12 hours and they go on a rotation, because I'm used to like an 8 to 5. So I was like, oh, okay. And so that was a new thing for me to learn. And I guess the only other challenging thing for me when I was in the course was I didn't realize that there was gonna be a not practical, the clinicals that you needed to partake in, because I was taking a few other classes and I was working, and so I had a pretty full schedule, and then I didn't realize I needed to commit time to clinicals. So kind of prepare for that towards the end of the course, and go into it knowing that there will be clinicals, so not to pack your schedule so tight you're kind of over surprised.
Pam, you're shaking your head. Do you want to go next?
Well, because what John just mentioned frequently is something students don't take into consideration. Even though it's stated in multiple places to prepare and to know it's going to happen, and the clinical schedules often aren't yet determined when the class starts. And you can know it up here, but the reality when it comes to putting all those pieces together, and then you're like, oh, I forgot that piece. It frequently happens that students are a little bit surprised that, oh, that I didn't allow myself enough time, or I didn't allow myself enough flexibility in the schedule. So that's why I was kind of shaking my head, because it's a frequent thing. And we do try and put it out there in many places for students, but there's so much information coming at you when you first start that you can only absorb so much of it.
Anything else you'd like to add?
I think sometimes for students, the challenges can come. You work with patients day in and day out. Many times in nursing homes, you have worked with them for years and they die. And the emotional challenges when you lose several patients. They add and enrich your life in so many ways as you get to know them. But it can be very challenging to learn that balance of being very compassionate towards them, being that patient advocate and protecting them and caring for them, and yet maintaining an emotional distance so that you're not devastated each time you lose a patient. You mourn, you're sorrowful, but you're not devastated. And so that can be really challenging, especially for young CNAs. And we're talking to high school students. I have known many high school students who've gone through this, who have become amazing CNAs, amazing nurses. But that initial part of losing patients was very challenging for them.
Jesse, what would you like to add?
Yeah, no, I agree with what Pam was saying. We work on an oncology floor here. That's it's a challenge, when you lose a patient, and, but at the same time, like she said, maintaining compassion, because that's why we do this, is because we want to take care of the patients, and the patients are the priority, and they're the focus of what we're doing, and we want to do it well. And learning to handle the emotions, and sometimes it's negative emotions, like people are angry with you and it's not really you, it's their situation. And CNAs honestly take a big brunt of negative emotions from patients, and not being able to take that personally is huge. Realizing you have to really compartmentalize it and realize that that patient is not angry with you, that patient is angry with their circumstances or their situation, and just to come right back in the door, 10 minutes later and say, hey, are you ready to get your next set of vitals done? It's a learning process. You're not going to get it right away. But, hang in there. You just take it one step at a time, and the nurses are good resources. You have fellow CNAs you can talk to and process things through, but, I encourage people to remember not to go in the direction that those emotions want to take you, which is usually negative or complaining or upset or angry back. But just to realize, just to take a deep breath, let it just go where it needs to go, and that's just out the window. Just don't hold on to it, because it's not your emotions to hold on to, really. It's just a circumstance that those patients are in. So really, it's a tough part. It doesn't come easy, but you do get it, and you just gotta keep plugging along with it.
I love all of your comments, actually. Those were all really, really great. Pam, I'm going to send this question your way. What can I do as a 16-year-old to become more involved in becoming a CNA?
Well, if you think you want to go into being a CNA or going into a healthcare career as a high school student, one of the best things you can do is focus on your core subjects, your math, your reading, your writing, and your science. I often deal with students who would like to jump clear to, I want to go be an RN. If you can't read well, you are going to really struggle with the massive amount of reading that is involved in nursing school, CNA training, the being able to read charts, being able to read the instructions. You've got to be able to read well. Math, you know, as a nurse, you want somebody to do their dosage calculation right 100% of the time. But as a CNA, you also need to be able to do your math well, because you're going to be tracking things like fluid intake and fluid output, and you need to be able to add those things accurately. That is information that can affect what kind of medications patients get, what kind of treatments. So it's not a frivolous course. And your sciences help you better understand the body and how it works and how a disease affects it. So that's academically one of the best things that you can focus on as a high school student. The other thing is, I have dealt with high school students who have been really surprised that to participate in clinical, they must pass a background check. And oh, that being caught at a party and maybe you weren't drinking, but the others were, and you now have a MIP on your record. Doesn't bode well for you. Sometimes students think, well, that doesn't count because I was under 18. It does count. So make wise choices about the activities that you participate in high school if you want to go into any sort of healthcare career. And like I said, sometimes it isn't that you did it, but who are you choosing to associate with that got caught and now you're guilty by association. So
I like that. We are almost out of time, so if you guys could each give me your 30-second piece of advice to anybody wanting to become a CNA, like what do you want them to take away from today if they watch nothing else but the end, which wouldn't make sense, but what is your 30-second piece of advice? Jesse.
Being a CNA is a very rewarding job. It's not an easy job. It is also a really great, it's a great career, but it's also a great kind of launching pad to going into numerous medical fields, whether you want to be a nurse or an MA, or you want to be, involved in like radiology technician, surgical technician, just all of those really gives you a good foundation and understanding the medical platforms that are out there. It just gives you a good exposure to just kind of the whole hospital process if you end up working in the hospital. So I highly endorse it. I really enjoyed, I think anybody who's going to be a nurse, especially like I did, should be a CNA first. It's just a great launching pad for it. It's really critical, just learning skills that you get that really apply to becoming a nurse later on down the road. So,
thank you. John, your 30-second piece of advice.
I would say you can do it. Like I thought I've put this off until my later part of career second part, because I was afraid to clean up stool, urine. I wasn't quite sure if I could stomach that. But when you see a patient that relies on you, that they need you to clean up and help them, you can do it. It's you'll be okay. You don't need your kid gloves. Well, you need gloves, but you'll be able to help them.
I love that.
Sure.
Yeah, I don't have kids, so I was kind of afraid. I was like, oh boy, I hope I can do this. You can do it.
Thank you for that encouragement. Pam, what would you like to say?
I would say that if they're considering it, and talk with those who are CNAs, those who are nurses. It is a very rewarding career. And as Jesse mentioned, and I've mentioned a couple times, it's not easy, but it is very rewarding and is a great launching pad. Definitely do some consideration of it, and talk to those who are in the field and get a sense of what it's like being a CNA in that field. It's a little different in the hospital than in a nursing home, than in a rehab center, but you have lots of opportunities out there.
Awesome. Well, that brings us to time. So thank you all so much for joining us today. Attendees, panelists, we really appreciate you taking the time. If you have any questions, you can email the college and we'll redirect those questions to whoever, whether it's Jesse, John, or Pam. If you want to talk with them more, just email info@fbcc.edu and we can get you connected to the person you have questions with. Have a great day, everyone. Thank you.
Great, thanks. Bye.
Bye.